What is up? Welcome back to my channel. My name is Annie. Today I am doing a 1-year update on my teeth. I got braces last year, August 1st, 2024, and today it is August 1st, 2025. So it is exactly 1 year. I want to compare what I started with and where I am now. Here is my teeth 1 year ago. Hi, I just got my braces put on. Ah. And here it is now. It's always kind of awkward to do those close-ups, and I actually just had an appointment yesterday. They say my teeth are doing well, they're straightening well, which is so good to hear, and I'm really happy with where I'm at right now. So just to kind of give an overview about my teeth journey, I already had braces as a child. I think I was 11 years old. However old I was in 5th grade, I think is 11. I already had braces then and took them off in 7th grade, so that was 2 years. And then as I got older and older, I'm in my 20s now, my teeth just totally shifted, misaligned, not in the regard that they were like going in all different directions, like crooked or anything, but my bite was severely misaligned. I had an open bite, and now obviously we're working to align my bite. Last year, before getting the braces put on, I had 8 teeth extracted, all 4 of my wisdom teeth, and then 4 premolars extracted, 2 on the top and 2 on the bottom. As you can see, like the gaps have closed very well, which I'm so happy about, because I was always scared about the gaps not closing. And here is a lingering gap. Of course, we're still working on closing that. I will have the braces on for another year if all goes well, so the total will be 2 years, and they did tell me that up front that'll be about 2 years, so we'll just see how that goes. I did some digging into my old papers that they gave me. Let's start with some of the pathology of my jaw and kind of what may have caused my severe open bite to begin with. So I have an oral surgeon who specializes in maxillofacial surgery. Back when I was doing my scans, I got a CT scan. I have his observations here about my TMJ. This finding in combination with bite changes in the patient's age is suggestive of idiopathic condylar resorption, also known as ICR. He says that the pattern of degenerative changes may still be suggestive of an active inflammatory process. So they kind of want to see if I continue to have degeneration in my TMJ, my temporomandibular joints, a referral for blood panel to rule out systemic autoimmune conditions such as juvenile idiopathic arthritis or rheumatoid arthritis. So that is why he recommended me to a rheumatologist. I did do a blood panel and it was positive for I believe ANA, which is an inflammatory marker in your blood, which suggested an autoimmune disease such as rheumatoid arthritis. But upon seeing the rheumatologist, my symptoms don't really fall into that diagnosis, and a lot of times it is just based on symptoms and signs that you're having. But my other joints are okay as of now, so that is to be determined. And then this is CT scan, I believe. Yeah, I think it's my CT scan, not x-ray, of my jaw. Oh my gosh, it looks like a monkey or something. That's so weird. Yeah, so it looks like this. Do I look like that? I feel like you can definitely see the interior open bite, like it's just so protruded. And yeah, it was hard to close my mouth. It was hard to speak, and my lips would get dry because the protrusion was just so severe. It was hard to eat and chew, and of course, like air would just kind of go through the gap in my top and bottom teeth, and I would have a lisp. I kind of have a lisp right now too, because there's still gaps right here, like there, for example, but it's really not as bad compared to as before. Okay, let's talk about everyone's favorite topic, which is finances. So I go to an orthodontist that is near where I live currently. I really like this office. Everyone's really nice and is really patient with me because I have so many questions. When I was thinking about receiving treatment there, they helped me answer a lot about insurance when I was confused. But I just wanted to be really transparent about pricing so that this can actually be helpful to any of y'all who are looking for braces as an adult. I am paying for my braces by myself. This is my official financial agreement. The fee for the orthodontic treatment is $6,600 plus $370 diagnostic records, less $2,000 from my dental insurance, for a total of $4,970. So that is the total that I owe them, and this includes diagnostic records, placement, removal, retainers, and all office visits necessary for Annie, me, to achieve orthodontic success. And of course, I paid an initial payment up front. I actually don't remember how much I paid for the initial payment, but my monthly payments is $105. This wasn't really a topic I wanted to talk about before, but I just thought of it, which seems pretty pertinent. I just want to talk a little bit about pain. I was actually conversing with the orthodontist yesterday about how when I was younger, it felt like the pain was so much worse, but now as an adult having braces, it feels very much more tolerable. I'm not sure if that is because I am just tolerating the pain better, or if it really maybe hurts less or something. Of course, it's still very uncomfortable. For example, right now, it's sore, my teeth are moving, but it's not as bad to the point where I need to take pain relievers or that I'm up crying at night, anything like that. It's just uncomfortable. Thank you for watching, and please like and subscribe, and of course leave comments and questions about anything you want to know about having braces as an adult. And as always, stay well. Bye!